Hello, my name is Amberly Briones.
Hi everyone, I'm Justin Nguyen.
Hey, I'm Carl. Just Carl.
Hello, I'm Maha. The first article, named Internet Searches for Opioids Predict Future Emergency Department Heroin Admissions, aims to find a reliable resource of predicting heroin-related admissions. The article describes how using the internet search data may be a resource for predicting heroin-related admissions and can possibly determine the next public health outcome as it relates to the opioid crisis. The hypothesis that was tested in the paper was that heroin-related emergency department admissions might be preceded by people searching online for information relevant to opioids. By looking through Google Trends data, the data could be used to predict the next year's emergency department for heroin-related admissions. They were able to get data from 9 metropolitan statistical areas in which they were able to identify 12 prescription and non-prescription related opioid terms for use in the final model. They used a linear mixed model in order to assess the relationship between the normalized volume for searches using opioid-related search terms and following yearly heroin-related visits to the ER. In their results, they found that across all of the metropolitan statistical areas, the heroin-related admissions increased from 1,194.7 per 100,000 population in 2005 to 1,358.3 in 2011. They discussed and concluded that internet search data may enable low-cost early detection of public health events or outcomes, and that it may also be a new valuable resource, but they need to increase their data in order to represent a large number of people. I believe using Google Trends data is an innovative step towards the future of healthcare, especially in terms of the opioid crisis. Although it is very innovative, I believe more research using Google Trends needs to be used in order to show its accuracy and predictability.
So here's where predictive analytics come into play in the world of clinical care. Using these large sets of data, people can do predictive analysis or use electronic algorithms to forecast future events in real time. This has the potential to save lots of time and money by quickly predicting what is the best next step or procedure a patient should take. While this technology has a wide application and benefits, there are some cons to it. It comes with the potential for misuse and bias if it's not used properly. Each PA algorithm is created differently, and the results can vary based on the stakeholders and what they prioritize. One hospital may prioritize saving costs, while another may care more about the physician's workflow.
About the development of these models is the amount and the validity of the data used in creating these algorithms. Low sample size generally leads to having outlier data that can influence more of the results, while having incorrect or unrelated inputs leads to having incorrect outputs that don't correlate with the intended purpose of the model. Another thing to consider about the model is when the model itself and the physician have differing interests in deciding on treatment. The article gives an example of this where a model does not recommend doing surgery, even though it is against the individual patient's needs as well as the physician's obligation to advocate for the interests of the patient. But in the end, it is the physicians who are responsible for using all the resources they have, including using the PA technology and the evidence-based medicine to help identify what is best for the patient. Overall, I think predictive analytics have a valuable place in clinical care in helping identify what is the best for the patients in a cost-effective way if the models themselves are developed and used correctly.
Pros. 1. Internet search data is less costly and reports real-time information as compared to conventional surveillance data, which is more costly and suffers from reporting lag time. 2. It makes it easier to pinpoint areas of high heroin admissions, which in turn would allow public health officials to target these areas and provide the care and assistance needed to lower heroin admissions. 3. Using internet search data and even social media data, researchers could be able to figure out trends and behaviors of opioid users and even discover new names that people use for different opioids, making it easier for researchers and public health officials to track and prevent opioid admissions. Cons. 1. Tracking people's internet search data is intrusive of their privacy. 2. There are limitations when it comes to internet search data, especially when researchers may be focusing on one database, like Google Trends, since not everyone uses that same database for these searches, or some people may not even use search engines. 3. Last but not least, since opioids sometimes have street names like brown sugar, it is hard to filter the data to pertain to the drug rather than the baking product. This shows that internet searches do not always correlate with the expected item or idea and is therefore not always an accurate indication of an outcome.